Hi, my name is Brianna. I am a speech language pathologist at Partners in Excellence. I've been here since 2015. Speech language pathologists really work on a variety of different things. We work on expressive and receptive language. So expressive is really, using language and communicating, where receptive language is understanding, so following directions, identifying. SLPs can also work on articulation, so productions of speech sounds. We work on social language, so interacting with peers and having conversations. SLPs can work on play skills, so playing with our friends and being able to, play with the farmhouse. Sociodramatic play, so house and coffee shop and all those fun things. SLPs definitely work a lot on alternative forms of communication, whether that's a picture book, a high-tech communication device, and that's something we do quite extensively here at Partners in Excellence, is work with our families and the ABA team to get our kids communication devices when it's appropriate. SLPs also can work on feeding therapy for kids, whether that's working on oral motor skills or increasing diet for kids that might need to expand their diet as well. I think one of the greatest things about working at Partners in Excellence as a speech therapist is the collaboration among disciplines. So we get to work with our BCBAs and our ABA therapists and our occupational therapists and really look at the whole child, and we get to see what they need from a behavior standpoint and what they need from an occupational therapy standpoint, their fine motor, their gross motor skills, and really come together and see how to find the best outcome for that child so that I can support their communication needs as a speech therapist and really watch them meet those long-term goals. I think one of my greatest success stories was when we had a 6-year-old child come to us who had not any functional communication, and we trialed a high-tech communication device, and the first thing he did is whipped it out and brought out a keyboard and told us that he was sad. I was in there and the BCBA was in there and mom was in there, and we all just started to tear up. And it was one of those moments I think you dream of in having your career, where you watch these doors open for kids with communication. So I think that's one of my favorite moments. I think kiddos who maybe aren't talking or aren't meeting their developmental milestones for language can definitely benefit from speech therapy. So if your kiddo maybe isn't producing speech sounds, or if they don't have language by the time we typically would see, first words between 12 to 18 months, or combining words for sure by 2 years old. If they're not responding to their name, or if you don't see any following directions, social smiles, pointing at objects, naming objects, those are all good hallmarks that we're looking for with our early learners. If your kiddo isn't meeting any of those milestones, those are definitely kids that can benefit from speech therapy. Or kiddos that maybe don't have any language, we can work with parents to find a functional communication system. So Partners in Excellence definitely uses a play-based approach for our speech therapy. We like to incorporate all of our goals into natural environments, so we're definitely on the floor with the kids, playing, incorporating our goals. We do some table teaching for older kids, but love to be on the floor and incorporating those so that we see the generalization of skills. We also really love to have our parents as a part of therapy, so we're always wanting parents to come in and collaborate during sessions as often as possible. I think one of the unique things that speech therapy offers at Partners in Excellence is really that door to communication for our kids. Our biggest role here is to open that door to communication for our families and our kids, and to give them that key so that they're able to communicate what they want with us.